Well, welcome back to our hour-long special, Understanding Healthcare Reform. Joining me now is Jeff Rubleski he's the Director of Sales Strategy for Blue Cross Blue Shield of Michigan. Like Marty, Jeff's been all over the state. He's been answering questions, educating people on the Affordable Health Care Act. Jeff, thanks so much for being here. We have talked tonight about individual coverage. We spoke with Marty about that. But healthcare reform, it's been a big concern for employers here in Michigan and northern Michigan. What are some of the concerns from an employer standpoint when it comes to healthcare reform?
Well, that's a good question. I've spoken to literally hundreds of employers, and I think for many employers, it's just trying to understand the law and how the law will impact their organizations and their employees.
It is complex. It's difficult to understand from an employee standpoint, and I'm sure from an employer it's also had quite an impact. We've heard about the differences between being a small employer and a large employer. How are those defined, and what are some of the differences?
Well, the Affordable Care Act has a unique definition for small employers and large employers. For example, a small employer is an employer who employs between 1 and 50 full-time equivalent employees. So that includes full-time plus part-time employees. And a large employer is 51 or more full-time equivalent employees. So two classifications for employers.
We have a lot of small employers up here in northern Michigan. So what are the mandates for a small employer out there?
Well, that's a great question. When we look at the small employers, there is no mandate. So small employers are not required or will not be required in January 2015 to provide coverage. However, one of the things I advise individuals who work for small employers is to ask their employer if they're going to continue sponsoring coverage. And what we have found is the vast majority of employers of all sizes, small and large, will continue providing coverage to their employees.
That is kind of reassuring, I'm sure, to a lot of those employees out there.
Well, it is. And when you think about why people come to work, people come to work certainly for what an employer pays them, but right behind it is the benefit structure and the health benefits. Very important for individuals.
I'm sure it is. So there are some new rating rules out there, as I understand it.
There are. And employers need to really take a look at how this dynamic will change, because when we look at these new factors that will go into place for small employers, we now will look at age. And there is what we call an age banding that all carriers have to follow. Okay. And it now will move to a 3-to-1 ratio. When you look at how it is right now, some carriers are a 5-to-1 or 7-to-1 ratio. And what that will do is that will actually constrict the amount of variation of rates between younger individuals and the older individuals. And when we look at how insurers will rate, there's a category for children, and then categories for each age level up to age 64. And the great thing, as Marty said, is that health plans can no longer rate based on health status. Blue Cross has never done that, nor has Priority Health, but some carriers have done that historically, and now carriers will take you regardless of your health.
Well, that is good news. Let me ask you this. Does it matter, speaking of factors that may impact your coverage, does it matter where in Michigan I live as an employee or where in Michigan I live as an employer? Does that impact it?
It does. The Affordable Care Act and in Michigan looks at 16 unique rating regions. And I had the opportunity to look at the Traverse City area in terms of how it is rated at Blue Cross. And the Traverse City area is actually one of the lower cost areas. And I think a lot of that speaks to the lifestyle here and to the excellent health care options that people have.
All right, so where we live can impact what we pay. Are there any other lifestyle choices that can impact what coverage is available?
Absolutely. The Affordable Care Act really takes a look at tobacco, for example. Insurance carriers have the ability to actually increase the rates if somebody uses tobacco, primarily smokers. And insurers have the ability to actually increase rates up to 50%. For small groups, Blue Cross is looking at that option, and we're not planning to implement a smoking charge in 2014, but for individuals, there will be a slight charge for smokers.
Well, that can certainly, there's a lot of wiggle room in there. If it's up to 50%, that can have a significant impact. Are there penalties in place for large employers that don't meet these mandates?
Penalties will go into effect January 2015. In fact, that was rolled back last summer. The penalty for large employers was scheduled to go into effect January 2014, and that was pushed back due to some of the complexity that large employers had, questions they had about the Affordable Care Act. So that's being moved back 1 year, and it only applies to the large employers that employ 51 or more full-time equivalent, or 50, full-time equivalent employees.
And what are some of those penalties that they could face there?
Well, the penalties, there are a number of factors that employers have to look at. The first is what we call affordability. And what that really looks at is how much is the employer asking the employee at the employee, or what we call single level of coverage only, how much is that employer asking that employee to pay? Mm-hmm. And that amount needs to be less than 9.5% of that employee's income. The good news is, and we've looked at thousands of organizations throughout the state, is that most employers meet that criteria. Okay. And the second one is that the plan must meet what we call minimum value. Marty mentioned the bronze, silver, gold, platinum levels. Well, the benchmark plan needs to be at least the bronze level, which means it must cover at least a 60% value. Most employer plans meet that. And then third, for an employer to have a penalty, the employee has to follow the first two steps and then buy coverage via the exchange. So a number of steps. And so really the takeaway, Mark, is this, is that most individuals who have coverage provided at the workforce will essentially stay with their employer's coverage because there will be no financial advantage whatsoever to go onto the exchange.
All right, good to know. Now, healthcare is a major expense for employers. You ask any employer out there, they'll tell you that. So how are they going to fund this? How are employers, what are some strategies they're going to use to cover this expense?
Well, employers will look at it at a number of factors. In fact, some employers are looking at a way to finance their plan called self-funding, which means that they take on a little bit more risk, and that gives them additional flexibility. The law allows, the Affordable Care Act allows small and large employers that self-fund their benefits additional benefit flexibility, and whenever there's additional flexibility, that can lower cost for the employer.
So how are employers going to pay for this?
Well, that's a great question, the way that they always have.
Okay.
And, employers struggle with that every day. In fact, when you look at a service-based organization, the second highest expense behind wages and salaries is the health care expenditure. Yeah. But most employers are stepping back, looking at the Affordable Care Act and saying, it's important that we continue to sponsor benefits because it's a way we attract and retain our best talent.
These mandates, these changes are most likely going to increase costs for everybody for coverage, aren't they?
In the short run, absolutely. Okay. The whole idea behind the Affordable Care Act, regardless of how one feels about it, is that if we can get more people covered, the idea is that will lower the overall increase in cost. And in fact, when we look at the cost increases, depending on the plan, we're estimating that the taxes and required benefit mandates will add anywhere from 5 to 10% to the cost of coverage.
So we brace for it now and then hopefully see the payoff down the road. Is the theory behind it?
The theory behind it is we pay more now so that we can lower the rate of increase in the future.
All right. Thanks so much. We're going to bring Marty and Jeff back together to talk more of the new healthcare regulations that everyone's going to be facing. And if you'd like, Marty, you can email us at newsroom@UpNorthLive.com. You can also tweet us a question using the hashtag AffordableCare. And you can call us. The number is 1-877-897-9726. Plus, we will take questions from our live audience at the Millikan Auditorium at Northwestern Michigan College. We'll be right back.